Welcome back all of you to nursing officer exams for various government exams like PSC, UPSC, RRB, ESIC, TAMES, NOSET, CHIPMA, etc. The first question: a published false statement that is damaging to a person's reputation is termed as option A slander, option B libel, option C rumor, and option D gossip. Right answer here is option B libel. Libel is the published false statement. You can see here the options slander, libel, rumor, and gossips. Rumor and gossip is the commonest term, so that is just a currently circulating story. But these other two terms, slander and libel, can be confused in exam hall, so just pay attention. Slander is the spoken false statement. S is highlighted here for your memory. Slander is spoken. Slander is a spoken false statement. Libel is the published false statement or written false statement. Next question. A nurse involved in crisis interventions adopt a technique which focuses on peculiar course of crisis, addressing common response of the group. This is termed as option A generic approach, option B individual approach, option C catharsis, and option D environmental manipulation. The right answer here is option A, generic approach. The key for this question is focuses on peculiar course of crisis addressing common response of the group. So it is a common response of a group, that is generic approach. When it is individual or particular to a person, then it is individual approach. Next question. The method of operation in which separation begins in the center of the placenta, the fetal surface, is termed as option A, mini-lap method, option B, Sherd's method, option C, Matthew Duncan method, and option D, Wortham's method. The right answer here is option B, Sherd's method. Here these two methods, Sherd's method and Matthew Duncan method, you have to pay attention because in Sherd's method it is central approach and the Matthew Duncan method it is leading edge approach. So one it is starting from the edge and the other one it is from center. Sherd's central, Matthew Duncan leading edge. Remember this. Next question. A client presents with persistent and pervasive feeling of apprehension, belief that he is inferior to others, and excessive preoccupation of being rejected in social situation. This type of personality disorder is option A, anancastic personality disorder, option B, avoidant personality disorder, option C, dependent personality disorder, and option D, emotionally unstable personality disorder. The right answer here is option B, avoidant personality disorder. Anancastic personality disorder is also called as obsessive compulsive personality disorder. Here the patient is having obsessive compulsive disorder like obsessions and compulsions. Avoidant personality, the person will be having inferiority complex and they are having excessive preoccupation of being rejected in social situation. Dependent personality, as you know, the person will be dependent on others. Next question. A palliative surgical procedure used in children with univentricular heart is option A, BT shunt procedure, option B, Whipple procedure, option C, Fontan procedure, and option D, Fothergill procedure. The right answer here is option C, Fontan procedure. Fontan procedure is used for univentricular hearts. BT shunt procedure is used for congenital heart diseases like TOF, tetralogy of Fallot. Whipple procedure is being done for pancreatic disorders, and Fothergill procedure is for pelvic organ prolapse. Remember these terms and the related organs or area for your exam preparations. Next question. The mechanism of action of morphine in a patient with heart failure is option A, it increases preload and afterload. Option B, it dilates pulmonary blood vessels. Option C, it increases myocardial oxygen demand. And option D, it works on a receptor in the heart. The right answer here is option D, it dilates pulmonary blood vessels. In a patient with heart failure, morphine's mechanism of action primarily involves central nervous system effects and vasodilation. So here dilates pulmonary blood vessels is the vasodilation action, which is the right answer. Next question. The test to detect congenital dyserythropoietic anemia type 2 or CDA2 is option A Guthrie test, option B Fallon's test, option C Hemp's test, and option D Piglu test. Right answer here is option C Hemp's test. Hemp's test is for detecting congenital dyserythropoietic anemia or CDA2. Guthrie test is for phenylketonuria in newborn. Fallon's test is for carpal tunnel syndrome, and Piglu test is for vitamin B2 deficiency or folate deficiency. Next question. Which is the best index for burden of disease? Option A dependency ratio, option B case fatality rate, option C disability adjusted life years, and option D morbidity data. The right answer here is option C disability adjusted life years. The most widely accepted and comprehensive index for measuring the burden of disease is disability adjusted life year or DALY. Next question. Brick red color of solution in Benedict test indicates option A no reducing sugar, option B trace amount, option C moderate amount, and option D high amount. Right answer here is option D high amount. You can see the Benedict test and indicators. This chart is already discussed many times in our exam preparation videos in previous episodes. So I will just go through it in a fast manner. If you need additional time, you have to pause the screen and analyze. This is color code also. Blue is nil, absence of sugar, blue to red. Then green is trace amount, green precipitate is +2, yellow precipitate is moderate amount, orange precipitate high, and brick red is above 2 or very high. Then next question. Prevention of emergence of risk factor is option A primordial prevention, option B primary prevention, option C secondary prevention, and option D tertiary prevention. Right answer here is option A primordial prevention. Prevention of emergence of risk factor itself is the method of primordial prevention. It is just like environmental modification of risk factors. Primary prevention is the prevention like vaccination. Just before the disease arrives, we will just prepare our body with vaccination, lifestyle changes, etc. Then secondary prevention is the timely treatment, because the disease already happened, in the early stage itself it is detected and primarily treating the patient. Then tertiary prevention is the rehabilitation process, because the disease is already there and we are already having the consequence of disease, but we are just modifying the life to adapt in a better way to the disease. That is tertiary prevention, to preserve the quality of life. Next question. Screening children for catecholamine secreting tumors such as neuroblastoma, pheochromocytoma, and other neural crest tumor is option A VDRL test, option B VAT test, option C Vidal test, and option D PMA test. Right answer here is option D VMA test. VMA test is used for pheochromocytoma. VDRL test, syphilis, it is for syphilis. VAT test is the vision acuity test, which is for eye. Vidal test is the test done for typhoid. Next question. A mentally ill client exhibit gradual or sudden deviation in the train of thought without blocking. The nurse identified this as option A tangentiality, option B derailment, option C seizophasia, and option D paraphasia. The right answer here is option B derailment. You can see the word itself, gradual or sudden deviation in the train of thought. Train and rail is related, so this is derailment. Tangentiality, as you know, it is wandering out of topic, not coming to the point. Schizophasia, it is word salad. And paraphasia is unindented syllables the person will exhibit. It is a kind of aphasia. Next question. Which of the below test is helpful in finding out folic acid deficiency? Option A, Hayes test. Option B, Figlu test. Option C, Benedict test. And option D, Hempas test. The right answer here is option B, Figlu test. Figlu test is for folate or vitamin B12. Figlu folate. You can see the first word is similar. Figlu folate or vitamin B12. Hayes test is for bile salt in urine. Benedict test we already seen, it is blood sugar. We have seen the chart from blue to brick red. Then Hempas test is for congenital dyserythroid anemia 2, CD8. Next question. A client during manic episodes has delusion of persecution and poverty. The nurse identified this as option A, mode congruent delusion. Option B, secondary delusion. Option C, mood incongruent delusion. And option D, primary delusion. This is a tricky question. You have to just read it properly and use your logic to answer this. Let us go to the right answer. The right answer is option C, mood incongruent delusion. Here you can see person with manic episode and has delusion of persecution and poverty. See, when a person is with manic episode, the proportionate or the related delusion will be delusion of grandiosity. The person is already excited, he is in a manic state and he will feel that he is the king or he is the superpower. So, the delusion of grandiosity is the ideal delusion he should develop. That will be related to the mood. So, this is mood congruent delusion means mania should have grandiosity. Here, it is opposite direction. See, there is mania and the person is feeling delusion of persecution and poverty. So, it is mode incongruent delusion. It is opposite direction. So, it is incongruent. So, these two words, mode congruent delusion and mode incongruent delusion, you have to be careful while answering. Next question. The sign seen in meningitis in which flexion of neck causes flexion of hip and knee is option A, Koenig sign, option B, Babinski sign, option C, Brudensky sign, and option D, Covert sign. Let us see the right answer. The right answer is option C, Brudensky sign. We can see the symptom of meningitis in Brudensky sign. Severe neck stiffness causes a patient's hip and knee to flex when the neck is flexed. See, this is the diagram. So this is Brudzinski sign and this is the sign of meningitis. Next question. Tics occur most often in which age group? Option A, infants. Option B, toddlers. Option C, preschoolers. And option D, school children. The right answer here is option D, school children. Tics occur most often in children, typically beginning between the age of 4 to 8 years old. Next question. Rete syndrome has triad in which the following is not involved. This is a negative word question. Be careful. Option A, arthritis. Option B, conjunctivitis. Option C, urethritis. And option D, glossitis. The right answer here is option D, glossitis. Rete syndrome has a triad, that is Rete's triad, conjunctivitis, urethritis, and arthritis. So this A, B, C is already there and D is not involved in Rete syndrome, which is glossitis. Next question. Expected weight of a 2-year-old child is 12 kg. According to Holiday and Segar formula, daily fluid requirement for this child is option A, 1000 ml, option B, 1100 ml, option C, 1150 ml, and option D, 1200 ml. The right answer here is option B, 1100 ml. You can see it's a 12 kg child. The first 10 kg, it will be 100 ml per kg. So, this will constitute 1000 ml for first 10 kg. Then remaining second 10 kgs, it is 50 ml now. Okay. So, 50 ml per kg. 50 ml per kg means there is 12 kg. So, 2 more kgs are there. So, 50 ml per kg means it is 100 ml per kg. ml for the total remaining 2 kgs. So first 10 kg it is 100 ml per kg per day, that is 10 into 100, that is 1000, and the remaining 2 kgs 50 ml per kg per day, it is 2 into 50, that is 100. So 1000 plus 100 will be 1100. Just by heart this chart for the calculation in exam hall. Next question. The nurse educate the family members to involve the elderly in decision making and also in family function. This level of prevention is option A, primary prevention, option B, secondary prevention, option C, tertiary prevention, and option D, primordial prevention. So this is kind of prevention is option C, tertiary kind of prevention. Next question. A fold of peritoneum connecting the stomach with other abdominal organ is option A, pairs, patches, option B, omentum, option C, cullet, and option D, cisterna chyli. The fold of peritoneum connecting to the stomach and with other organ is omentum. So you can see the figure here. This is the fold of peritoneum. This is called omentum. Next question. An employer gives a false written statement regarding a newly appointed employee that she is unfit for the job. This is an example for option A, battery, option B, assault, option C, negligence, and option D, defamation. Right answer here is option D, defamation. You can see a false written statement regarding newly appointed employee that she is unfit. That's a false statement. That is defamation. Here the other terms you can see battery and assault. That is two similar words. Assault is threatening to cause harm. You can see the figure here. Battery, it is already the body contact. The actual harm is already happening, causing actual harm. So assault and battery. Assault is physical and mental assault, threatening. Then battery is the actual harm happens. The chance of vaginal delivery is greater when Bishop score is option A 5 points, option B less than 5 points, option C 6 to 7 points, option D greater than 8 points. The right answer here is option D, greater than 8 points. Here you can see score less than 4 is unfavorable, unraised cervix, induction may be difficult here. Score 5 to 7 is intermediate, may need ripening or a combination of approach. Here score more than 8 is favorable, high chance of successful vaginal delivery. Next question. A client receiving antipsychotic may develop extrapyramidal side effect. Which among the following is an anticholinergic drug which is used to reduce extrapyramidal side effect? Option A, bromocriptine. Option B, triethylphenyl. Option C, cinnamate, and option D, pergolide. Right answer here is option B, triethylphenyl. Triethylphenyl, also known as R10, is an anticholinergic medication commonly used to treat extrapyramidal symptoms or EPS caused by antipsychotic drugs. Next question. The leading brain tumor in children is option A, Willis tumor, option B, astrocytoma, option C, neuroblastoma, and option D, osteosarcoma. The right answer here is option B, astrocytoma. Willis tumor is a renal carcinoma in children. Neuroblastoma and osteosarcoma. Osteo is in bone, neuro is also brain tumor, but astrocytoma is the leading brain tumor in children. Next question, which is the last question of this episode. A mental health nurse, while rendering care to a mentally ill client, should not argue against her psychotic symptoms. The most appropriate mental health nursing principle applied here is option A, avoid unnecessary increase in patient's anxiety. Option B, observation helps to understand the behavior. Option C, use of self-understanding as a therapeutic tool. Option D, nursing care is centered on the patients as a person. The right answer here is avoid unnecessary increase in patient's anxiety. When you are arguing or when you are just irritating the mentally ill patient, it will unnecessarily increase the patient's anxiety. This principle should be kept in mind while you are dealing with psychotic symptoms. Thank you all for watching this video. We are winding up this session with this question. Please add your valuable feedback and please like and share this video. If you are not already subscribed, please subscribe this channel for more exam preparation and entertaining videos.